News to 8:07. We're at minus 12 degrees now. Over to Suzanne.
Thank you, Aisling. Dr. Mark Frobb is a pain management physician with a special focus on spinal care problems. Recently releasing his second book, Surviving Whiplash, Saving Your Neck Without Losing Your Mind. And wow, what a tough one this one is. Dr. Frobb has discovered that there are a lot of whiplash myths out there. He's here to help dispel some of them. That's what the book is about. It's all about attacking those myths, and a huge challenge for patients, I assume, that you see every day.
Oh, the entire minefield of whiplash is all about myths. Everything from the damage, that you have to have damage in your vehicle before you have whiplash, to that it's easy to diagnose and treat, and then a whiplash is a whiplash is a whiplash. And that's not true at all.
Yeah, there's so many ways that this can go. So you brought in part of a spinal cord, I'm assuming this is?
Well, this is the shoulders. This represents the shoulders. This is the back of the head. So this is the cervical spine.
Okay.
And so essentially there's two things to appreciate. One is the whole thing takes place in the blink of an eye. In 300 milliseconds, which is faster than the body can respond to, the whole injury is going to be done. So the first part of the injury is when you're struck from behind, the head stays in position, but the shoulders and torso move forward. So you hyperextend the neck. The second part of the injury is the head and neck then whip forward at 2.5 times the speed of the original collision. And that's where the shearing and tearing happens in the soft tissues.
All right, there are a lot of signs and symptoms. I was going through the list. What are some of the ones that really stand out?
Well, essentially everybody appreciates and expects the pain. So there's pain in the upper back and the neck and associated with headaches. But as well, what is not appreciated is the tremendous amount of stress. First of all, 1 in 4 of these patients are going to have some element of post-traumatic stress disorder. We tend to associate that with war-type injuries and major disasters. But for most people, this is going to be the major traumatic episode of their life.
Really?
Absolutely.
Now, you said that there's a real window of opportunity for these kind of injuries. What do you mean by that?
Well, when you have the shearing and tearing, you have an inflammatory soup as the noxious chemicals leak out and bathe the nerves. You must make sure that you dissipate that in the first 3 months. If they tend to bathe that nerve, you're going to go on and develop chronic pain syndromes called neuropathic pain syndromes. So you must, as much as possible, try and mitigate the injury in the first 3 months.
And that means seeking medical help?
Absolutely.
What else?
One of the key things is if you have significant pain that it interferes with sleep, especially if it's immediately after the accident, you must seek help. And that means you see a competent physician and therapist and recognize that you have an injury, and then quickly educate yourself, because you must become a co-director and an advocate for your own care, because no one knows your body like yourself.
And that's the biggest challenge with injuries, it seems like this, in going through your book, is you are going up against insurance companies whose fiscal policy is against you in so many ways. So it's a really tough battle for a lot of people.
Well, and that's one of the myths, is that your insurance adjuster is your best friend.
Yeah, not the case.
And essentially they may appear sympathetic, but as you point out, their fiscal mandate is to limit the claim. So it's really important that you educate yourself, and they're going to be quick to point out that there's no damage to your vehicle.
Right.
Yet you've well exceeded the physiological tolerances of shearing and tearing. For example, at 13 kilometers an hour, a woman of your size would have experienced 800 pounds of vector stress to your body. That's a lot of tearing and shearing.
Wow. Okay, so that's plenty for damage to be done.
That's right.
All right. You say no crash, no cash, and that's what you're talking about with the insurance companies. That's a policy that's kind of, not talked about, but it's certainly there. So another one that you said is when might you need an accident reconstruction engineer? And then you talk about taking photographs. This is very in-depth.
Well, the entire process before you get in a court of law, it's going to be 2 to 3 years.
Really?
So
wow.
Memories tend to fade. So one of the parts of surviving whiplash is to have an effective documentation, and the glossary has 10 pages of checklists of all the things that you must do at the time in the early parts of the accident. Everything from, did you go to the hospital? What was the speed of the vehicles? What were the size of the vehicles? What were the road conditions? All of these will affect the vectors of the force. What doctors did you see? What treatments did you have? What investigations did you have? All in chronological order, because in the end, it's you as a credible witness in a dispassionate and objective way that is going to give you the most credibility when you end up in a court of law.
What about the stigma out there that these kind of people who are suffering these injuries are trying to get money? They're frauds.
in over 30 years of clinical experience, I've seen very little of that.
Yeah.
If you look over the history, and I think to some extent that may be perpetrated by the industry itself. I mean, it's not a level playing field out there. You know, they have very large organizations behind them. The whiplash victim needs all the advocacy they can, and a self-help book to help them navigate through the injury, the understanding, the recovery process, as well as how to deal with the insurance company and how to find a competent lawyer to represent you should you have to go down that road is critical.
Well, it's an intimidating process, and if you're on top of all of that, suffering a lot of chronic pain, you can imagine the road that is ahead. Surviving Whiplash, saving your neck without losing your mind. This is a resource. This is a guide that'll walk you through the process. Check it out, www.survivingwhiplash.com. There's also lots of great free information on that website to get you started on that process. Thanks for coming in this morning. We appreciate it.
Thank you, Suzanne.
We're going to take a break on BT Weather and Traffic. The Wednesday